Patients want your help at home. This is why this delivery model will take over healthcare. For those that don't know, my name is Theo Harvey. I'm a healthcare consultant and entrepreneur. And one of the things that we're seeing tremendously is what healthcare organizations are looking at as they look to grow for the future. One of the key things that's happening is patient care being delivered at home or remotely is becoming table stakes now. Tons of different opportunities where we're seeing healthcare organizations look for ways that they can deliver it at scale. Because let's be honest, the healthcare system was not meant to deliver care remotely. So let's talk a little bit about why this is important. By 2029, we should see the outsourced market grow to about $233 billion. That's an increase from 131 in 2024. Outsourced healthcare services is going to be more and more important as healthcare organizations are constrained by their current budgets to grow where they see possible. That's why we're talking about a new delivery model. This delivery model is called Remote Care as a Service, or RCAS. It's a new term, but it's something that's been around for ages. Obviously, telehealth is a component of that piece, right? But remote care as a service is definitely more comprehensive. It's a more delivery model that combines technology, processes, and financial acumen in order to deliver care at scale for patients that want it at home. One of the ways we think about it is you have to think about the technology. The advent of telehealth spearheaded this, but that was only because of the ubiquity of smartphones and technology that can deliver person-to-person communication anywhere in the world. I remember talking to clients about how we're not just constrained to a geographic area anymore. We know what's happening anywhere across the world. And this is important when it comes to remote care. Having these cellular devices communicate wherever a patient lives is important, not just from a communication, but also to grab vital patient physiological conditions, such as blood pressure, weight. All these type of physiological readings can give insight into how the patient is helping. More importantly, we're seeing the advent of delivery of drugs and other type of services to patients at home. Tests are now being delivered at home. So patients can do a lot of the things that they used to have to go to the hospital or to the doctor to do. It can be delivered at home. And we're going to see more and more of that. Technology enabled by cellular enabled devices like blood pressure cuffs that have cellular chips in them that can deliver information wherever the patient is at. So having cellular technology is important and devices, but then how do you deliver that at scale? If your organization, having the technology is one thing, but being able to deliver it across the organization is going to be huge and very important. Technology can help with that as well. With the advent of artificial intelligence, the ability to do two things, right? One of the things that we see artificial intelligence help in is to be able to communicate to patients cultural relevant information. For instance, artificial intelligence is really good at scale. So that means it can personalize specific conversations to patients that need it most. We've seen cases where we'll be able to translate text messaging or even change messaging to make sure it fits a certain literacy level. Typically, we try to reach out to patients at the 5th grade level in any language so that a patient can understand exactly what they need to do at home remotely. Artificial intelligence is important for that. Artificial intelligence also helping to make our internal teams who deliver care remotely more efficient. The ability to have nurse teams that can operate in a command center type format where they know what patients to reach out to that's better triage is really important and instrumental in ensuring that patients get the care that they need at home. Artificial intelligence is already here and more healthcare organizations are utilizing it more than ever before. Obviously, there are big conversations around using it in terms of delivering clinical outcomes or helping to diagnose disease states. Also, there's conversations about how artificial intelligence can help with administrative work, which is all great and wonderful. But to us, the sweet spot is really about looking at it from a patient engagement standpoint because of the scalability and ability to kind of personalize those communications to patients and making it culturally relevant. One of the things we saw, trust, especially for patients in underserved communities, is at an all-time low when it comes to institutions. Healthcare is one of those institutions that unfortunately patients just don't trust. And so how do you engage in that trust metric? You have to provide communication channels that reach the patient where they live, not just text message, not just calls, not just mail, but an omni-channel approach, and artificial intelligence can help with that. So technology is about connectivity and access, increasing that with more cellular technology and smartphone technology, but also is delivering more efficiencies, being more productive, and personalize it with artificial intelligence. So that's one way technology is helping deliver remote care as a service. Hey, I hope you enjoyed that. Look, we have more content that can really help you accelerate your practice this year. We have tons of content that can cover all the different topics we discussed earlier. If you want to hear more, click to the right or to the left and you'll get more content to understand how to best grow your practice.